Thank you folks for dialing in today. I am Liz Powell, the founder of G2G Consulting, and I am so happy to have you join us today. We are going to, you can go to the next slide. We are going to cover these issues today. This is our agenda. We want to make sure that you have all the information you need about the upcoming military medical conference and ways to navigate government and access funding. So we've got an awesome team coming together to give you this information today. So as you can see, we're going to give a little bit of background on G2G. Some of you know us, but some of you do not. So we want to make sure that you do. And we're going to talk about these different streams for funding through Congress, the appropriations process, and earmarks. Yes, they have returned. We've got some insights on the Biden administration we'd like to share, some of the key priorities that are going to be going on right now with Congress and the White House, and then shift over to the military opportunities. So there's specific funding streams you want to make sure you know about, and then specifics about this conference. We'll close out with some case studies and then answer any questions that you have and give you some final tips so that you are very effective in navigating this conference and all the ways that you can access funding to grow your business. We are very passionate about biosciences, and we want to make sure that you have the tools to grow your business and bring very important innovations to patients. Next slide, please. So first off, my background. So again, I'm Liz Powell. I'm the founder of G2G. I started G2G after being a legislative director on Capitol Hill for several years, working for a couple of different members of Congress. I staffed all the health policy issues, but I also staffed some interesting committees. One was the Small Business Committee, and another was the Armed Services Committee. So I learned all the different funding streams, and there are many for medical innovation through Department of Defense that most people aren't aware of. I also managed all the appropriations requests, and in those days we did earmarks. So I would rack and stack for my boss and lead the effort to try and influence the different appropriation bills and subcommittees to get projects included and funding levels increased. So with that background, I then got my JD. So I'm an attorney, and then I have a master's in public health. I started G2G in 2007. So we're going on our 15th year now. After meeting many entrepreneurs and as well as researchers, institutions, and nonprofits who were doing great work, really making a difference, but they didn't know how to navigate government and how to access funding, especially non-dilutive funding, which is so key for startups. And so that's where I got the idea to start G2G, which stands for Government to Growth. So we're all about helping companies grow, organizations grow, to make a difference in the world. And so I have been very fortunate to build up a phenomenal team with tons of experience, way smarter than me. And we have raised over $315 million at this point for our clients since we started. We've influenced CMS reimbursement rates, coding, many different policies, ranging from cancer to weapons innovations for the military. I mean, all kinds of things. We definitely have a real niche in innovation space and in life sciences. We've been able to expand and have multiple locations across the country, as you can see, and definitely in DC. And we work with different chapters in the biosciences. So BioOhio, we have a long-term relationship with BioOhio and BioEnterprise up in Cleveland, but also in Western PA, we work with Pittsburgh Life Sciences Greenhouse for many years. Now we've got a partnership with LifeX. We've worked in Massachusetts, Florida, Kentucky, Indiana, Illinois, Michigan, all kinds of places with the common theme of life sciences. So we definitely are specialists in that area. We're also very passionate about STEM education, which is key for building the pipeline for the life sciences field. So you can read the rest. Clearly, we care very deeply about health innovation. Next slide, please. So this gives you an overview of the different funding categories. People will often come to me and say, well, I know some company that got this funding and how do they do it? There's really only 4 ways when it comes to government funding. So it's either legislation, grants, discretionary funding, or procurement, which is just a straight up contract for your product. So with legislation, we've got 12 appropriation bills that move through Congress every single year. And there's one authorization bill called the National Defense Authorization Act, also moves every single year. Now there's other bills that you'll hear about. We're now hearing about an infrastructure bill. We've got the Cures, and now it's Cures 2.0. And there are other initiatives like that, higher education reauthorization. So all those things are happening, but they don't happen regularly. It's every 3 to 5 years. And oftentimes they will just do an extension. So it delays it even further. Whereas those 12 appropriation bills, the National Defense Authorization Act, they happen every year. So that's where we put a lot of our focus. They're moving vehicles so we can jump on board and add our priorities that will help our clients and help patients and others in society. So that is legislation. So for grants, I'm going to leave that to my colleague Greg, who's really the expert on that. But we do a great job of tracking grants, especially for biosciences, and we've got some really innovative reports on that. And discretionary funding. This funding is little known and it is not as common. However, if you develop relationships with program managers, especially within Department of Defense, and they come up on the end of the year, for them, the end of the fiscal year is September. And so around the summertime through the end of September, there is a bit of frenetic activity to spend it or lose it. And so if they already have a white paper, they already have an existing funding vehicle with you, whether it's a contract or a grant, then you can access some of the discretionary funding opportunities. So that's something that really relies on those relationships. And that's what we're going to emphasize over and over again today. Relationships are absolutely key to getting funded. And lastly, procurement. That is a contract for your product. And the ideal way to move through government, advance your innovation, is to get on that early side, get a grant as you're developing it, and then get procurement once it's done. And the government's already invested in you, so they have invested interest in then providing contracts to you. So it all links up, and that's what we're gonna make sure that you take away today, that understanding. Finally, at the bottom of that slide, you'll see the different funding levels for each of the departments. And it is very clear. A lot of people focus, a lot of the startups we work with, they focus on NIH. There's actually a ton of money through Department of Defense, especially for medical innovation. And you'll hear about that later today, but the Congressionally Directed Military Research Program, or CDMRP, is the main grant program through Department of Defense for a ton of different health and areas, such as prostate cancer, breast cancer, ovarian cancer, rare cancer. So there's lots of different initiatives through that, and lupus, all kinds of health conditions that you might not think even belong in the military. They are there because members of Congress have heard from folks like you that these are health issues that need to get funded, that need to be addressed. So so the takeaway for that slide is that there's a ton of money within Department of Defense that perhaps you weren't aware of. So hopefully you know that now. So as I said, I'm joined by my phenomenal colleagues who have just a wealth of experience. So I'm going to turn it over to them and just ask, as each of you speak, please give your brief bio background before you dive into the slides. So thank you.
Hey everyone, I'm going to apologize in advance that my camera is not working today. I got all ready, but it is not working. So you do not get to see my face today, but hopefully in the next one you'll be able to see me. My name is John Richter. I am the Federal Legislative Director here in our Washington, D.C. office. I have been with G2G for a little over 2.5 years now. My background is on Capitol Hill and on political campaigns. I spent about 5.5 years working on healthcare, science and tech, and veterans issues in the Senate for a member of both the Health and the Finance committees. I also then worked on all those issues plus armed services, intelligence, transportation, education issues for a member of the House of Representatives who was on the Oversight and Government Affairs Committee as well as the Budget Committee. Most recently, I took a leave of absence from G2G and was Deputy Political Director in Pennsylvania for the Biden-Harris campaign. And previously to joining G2G, I was with the American Nurses Association. So today I'm going to talk a little bit about Congress and where things are. Both the House and the Senate have now established their committees and their subcommittees and their leadership on those committees. We are really working to get everything up and running on those committees and moving their priorities forward. COVID is still top of mind for almost all members of Congress. They were able to pass a COVID stimulus package COVID relief package, but this is still something that will continue to be really important going forward. They also, like I said, they passed a stimulus package. I don't expect this to be the only thing that they pass to help small businesses, employees, employers really recover from the COVID and the pandemic. We are hearing from the White House and from Congress that their next bit of priorities will be a jobs package as well as an infrastructure package. And then they also will probably seek to do some more healthcare reforms as well as we move forward. It is good to know, and I'm gonna get into a little bit more of what Liz talked about before with appropriations and NDA and earmarks in a second. But it is also what I really here to talk about is it's really good to know your members of Congress and what their regional priorities are, both in the district and on Capitol Hill. So it's always really important to do this outreach to your members of Congress, talk to their staff about the work you're doing, whether it be the district staff or their DC staff. Talk about the work you're doing, about how many employees you have in the district, about how you want to grow and build jobs and build economic development within their district or in their state. Members of Congress and their staff are always willing to not only meet with staff, but also do some site visits. I mean, right now it's a little bit of a difficulty because everyone is virtual. The site visits are probably starting up a little bit at a time, but members of Congress are always willing to come out and see the innovative stuff that you're doing and to help you grow and succeed with any federal help that is. And that's grant support letters, trying to work your priorities into bills, things like that. The appropriations and the NDA process are two great ways to be able to do this. Every year, Congress needs to pass 12 appropriations bills and an NDAA. These bills are either passed separately or oftentimes in omnibus packages, so it's all a few bills into one. Basically, what will happen is the appropriations committee and their subcommittees, or the NDAA, the Armed Services Committee for the NDA, have jurisdiction over these specific agencies, and they will direct how this money will be spent. Now, you can work with Congress to add some directive language or funding increases or policy riders to these bills through working with their members of Congress. So for the appropriations, every member of Congress has the opportunity to submit these funding plus-ups or directive language and their priorities directly to the committees. And every member of Congress is able to do that. Through the NDA, really only members of the Armed Services Committee in both the House and the Senate are really able to provide their input directly to the committee and have that input. Members can, so if your member of Congress isn't on the Armed Services Committee, they can definitely talk to their leadership or talk to their friends that are in Congress about some of their priorities. But there's also ability to do amendments when the bill's on the floor to get those things included into these packages. G2G is are experts in these areas to really to get this language inserted or get these funding increases inserted into both of these bills. And we have a lot of relationships with members of Congress of both parties in both the House and the Senate that we're able to set up these meetings. And we're really trusted partners for a lot of our Capitol Hill offices. And then moving on, as Liz said, earmarks are back this year. They are rebranded as community projects. This is member-directed spending. So members of Congress are able to say, okay, I want this exact amount of money to be spent on this exact nonprofit or this exact local or state government in my district. Usually these are not multi-millions of dollars. Usually these are hundreds of thousands of dollars, but it's a way for Congress to now say, okay, I want you to take this pot of money and here's how I want you federal agency to split it up and be able to do that. However, unlike earmarks you might have worked with in the past, these are really specifically tailored this year. So only nonprofits and state governments are really able to apply. Each member is only able to have 10 requests that's spread out over all 12 bills. There's really high transparency rules that members of Congress will have to put these earmarks on their website. They have to certify that they don't have any relationships with those companies or those cities or those industries, nonprofits in their, not companies, but nonprofits and organizations in their districts. They have to get community support for these projects. So it is challenging to apply, but it is definitely something on the right path to be able to have members of Congress look at a project, say, okay, this is a project that's going to increase economic development or increase jobs in my district, or help this nonprofit, help this state government, and I want to be supportive of this, and I'm going to submit this request for them. So members of Congress can start doing that starting next week, and they have until the end of April to really do all of those submissions. G2G are experts on how to do that, and we are here to help. If any of these things, the appropriations, NDA, or earmarks are paths you want to go down. And with that, I will wrap up.
Thanks, John. Hi, everybody. I'm Katie Collins. I am a Government Affairs Director here at G2G. I've been with the company about 10 months since last summer. Previously spent a good part of the last 12 years or so in the Obama-Biden administration. I was on Team Obama for about 5 years before switching over to then Vice President Biden's team, joining the staff of his White House Cancer Moonshot Task Force. I was the policy associate there, so in charge of health policy, mostly focused on cancer, as well as the public-private partnerships working to accelerate progress against the disease. Continued to work for Biden post-administration, standing up his policy work at the Biden Foundation, and then the Biden Cancer Initiative, focused specifically on cancer and continuing the progress that we'd started while in the White House. And then most recently worked with a group called Act for NIH, working with Congress to advocate for funding increases for the National Institutes of Health and for biomedical research more broadly. So wanted to chat with you today as we are several months into our new Biden administration. What are they working on? What are their key priorities, specifically on the health and bioscience side? So surprising to no one, COVID-19 is at the top of that list. We've been hearing a lot about their efforts related to vaccine rollouts and expanding eligibility, ensuring we're getting as many folks vaccinated as possible, as well as efforts focused on testing and tracing. So focusing on genetic sequencing, ensuring that we're tracking the variants that are unfortunately spreading, as well as focusing on therapeutics for those who do get the disease, and ensuring that we have a robust pipeline of supplies. So lots of that money from the most recent COVID stimulus package has gone to the states, as a lot of the efforts have been focused at the state and local level. But we are seeing some work within the task force on what a federal national approach to fighting COVID might look like. Close to my heart, Cancer Moonshot, what is that cancer effort going to look like? Biden is moving forward on that despite his focus on cancer. Met with a key group of members of Congress who are focused on cancer about 2 weeks ago to solicit ideas and input. From what we're hearing, the new Cancer Moonshot, whether it's called that or not, will likely be housed in the Domestic Policy Council. So we're waiting to see what that looks like, but it does seem like we're getting a move on it and should have something, hopefully to report soon as they're working to stand that up. Another thing that's been talked much about is HARPA. So the Health Advanced Research Project Agency, very similar to DARPA, which currently exists. Rumor has it that funding will be about $10 billion over 5 years. Eric Lander and the group at OSTP is in charge of, what does this look like, shaping the architecture of it. And current discussions seem to be focused on whether it will be situated inside or outside of the National Institutes of Health. Concern about the NIH budget and will this money come from the budget, be separate from that budget, be mandatory funding, et cetera. So still developing, but I think we will see HARPA instituted within this administration and not just an idea that's being floated. Cross-cutting agency partnerships and engagement, how can we utilize all of our federal agencies and their unique capabilities to make progress in the health space and elsewhere. FDA is top of mind for lots of folks since they do not have a leader. Janet Woodcock is acting director, has not been nominated for the full position, and has seen some opposition from folks in Congress due to what some folks feel inadequate response to the opioid crisis. So still shaping up, but lots in the field are saying we need an FDA director now, given everything that's going on. We are waiting to see what his budget looks like, what types of priorities he's identified. We should have what they call skinny budget next month, and we're expecting a full budget in May. And now that we have passed a COVID relief bill, turning to this $3 trillion infrastructure bill, and we'll be continuing to monitor where that goes. All right, next slide, please. So just want to touch on a couple of health issues that we're monitoring within the administration. We talked a little bit about COVID. Drug pricing is back at the top of the list with a Democratic majority in Congress. So expect to see some movement there. Telehealth is certainly top of mind. I think telehealth is here to stay, given the big advances that have been made during the COVID pandemic and reaching folks at home. So we'll be looking at Congress to see how they regulate telehealth in the future. Health disparities is certainly top of mind for both Congress and the administration. Unfortunately, this pandemic has really laid bare the inequitable access to care and health outcomes. So we expect to see a focus there. We talked a bit about NIH and funding for R&D. NIH has done a lot with the pandemic. I don't know that they've necessarily taken credit for all that they've done with their different RADx initiatives and with the vaccine support, but really shown that they can be flexible and innovative in times of crisis like now. Touched on supply chain, again, with COVID and unknown pandemics and other potential catastrophes to come, really ensuring that we have our products here that we need in times of crisis. All right, I can go to the next slide. Take it away, Greg.
Liz, you're going to tee up this slide and then I'll take it after that.
Sounds great. Thank you so much, Katie. So this gives you a snapshot of the key areas to target when you're going after funding and relationship development. NIH, I'm sure many of you know it well. You know the SBIRs, STTRs, R1s, those programs, those are definitely out there. Something to note, they are really good about going beyond that these days. And they've renewed effort towards women-owned businesses, helping others that traditionally have been challenged in getting through the NIH grant system. So they've been doing more webinars, which, hey, that's the silver lining of COVID. There's many more ways to reach people. So they've done a lot of targeted webinars. They've also got opportunities to help with pitching to investors. They've got the I-Corps program. So there's lots of other things that can help advance your business and accelerate your growth beyond just obtaining that SBIR. So NIH also, while they do have to do the independent review process, they are really good. A lot of the program managers will talk to us, talk about innovations and give us feedback and input before we ever make a submission. That can be really helpful to ensure that we have the strongest chance of getting funded. Next up you can see is BARDA. BARDA is the Biomedical Advanced Research and Development Authority, a mouthful. BARDA was created actually soon after 9/11, so it hasn't been around as long as NIH and some of these others, but it is a great resource. It is primarily focused on trauma care and how we respond to mass casualties. So they traditionally prefer further down the line as far as that R&D phase. So they want it at technical readiness level or TRL level 6 and above. They do not want that earlier stage. They also are primarily focused on COVID, understandably. We are starting to see some other programs come out of BARDA nowadays, but it can be a great opportunity, I think, to keep on your radar. And they've got a couple different pathways as you've seen listed here, the DRIVE program, ENACT, CARB-X. You can shoot us an email if you want to get into details on it, but the gist is that there are a couple different ways to apply for funding, and there's a couple different buckets of money. So one is lower, more like 750,000, and then the other can get 10, $20 million contracts. Also, the way BARDA works, they are all contracts, they are not grants. So again, shoot us an email if you want more details on that, but it is another funding source for anyone that's in that sort of mass casualty response, first responder area. NSF, National Science Foundation, I'm sure you're familiar with it. There's lots of good SBIR, STTR programs there. The EAGER and the RAPID program are more for accelerated allocation of funds. They also have a new pitching format that they've been using recently that tells you yes or no. You do a simple abstract submission and they tell you yes or no, that they want to see more and they want a full submission. So I think NSF has done a really good job at improving how people can make submissions and at least get answers faster. With SBIRs, as many of you know, you put so much effort into it. It's 20 pages or more, and it's such a process. But these other efforts that can give you some indication of interest before doing all that work can be really helpful and such a time saver for busy CEOs, which I can relate to. DOE, Department of Energy, also has the SBIR program, the ARPA-E program, and there's some interesting crossovers that we're seeing between energy and NIH that's been nudged forward by the Appropriations Committee in the past couple of appropriation bills. So I think we're going to see more of that in this administration. There's such a connectivity across environmental health between these two departments. DoD, clearly, as I said at the beginning, has the most funding to allocate. So that's a phenomenal resource. And they have not just the SBRs, SCTRs, but they have program announcements. And sometimes they even ask us for advice on how to shape those descriptions for what they're looking for. They will have program announcements around specific areas of health. And so you want to be looking for those in addition to the congressionally directed military research program I mentioned earlier, that is the grant program. So they will have specific announcements that you can respond to. The specific amount of funding that's available, and it's pretty clear. The BAAs, or broad agency announcements, those do not have a specific funding allocation tied to them. So you can make the submission, and it's a good way to sort of get in that pot of consideration, but there's no guarantee of funding or when you'll get funded. And we've worked with a few folks now that have gone through the process, they've been accepted. And what's great about BAAs is there's a pre-proposal and then the full proposal submission. And that pre-proposal determination is made by those program managers, the same people that we're building relationships with. And so they say yes or no. If they say yes, and you get invited for full proposal submission, it does go out to an independent reviewer. And then at that point, as I said with some of our clients, they've been awarded, but there's no funds yet. So they had to wait a few months until Congress allocated more funds for R&D projects, and then they could get the funding. So there are some little nuances around these different programs through DoD, but they're all very worthwhile. And with SBIRs, it's only a few $100,000, but with these program announcements and BAAs, it can be $1 million or just short of $1 million. So it is a bigger pot of money, which makes it a little bit more rewarding. DARPA is all about robots running the world, huge transformative innovation, another great funding source. And they have a lot of flexibility, basically to just, walk upstairs and get a signature. As program managers have said to me, the way DARPA functions is if their hair is on fire. Most program managers are only there a few years and then they're off to another agency. So they move very quickly, which is pros and cons to that, because on the one hand, you better get in and get considered right away to get funding. On the other hand, if the program managers that are in the BTO office, the biotechnology office, are not aligning with your sector, that's fine, because they're going to be out of there in 2 years. So then you can circle back. So I think that DARPA is definitely worth considering, especially if you're in that truly novel, transformative space. And tech, I'm sure folks are familiar with that. That was started about 5 or 6 years ago now, and has become a great resource for grant funding. It is competitive grants similar to CDMRP. However, the folks that really control the MTech program are more the trauma care, combat casualty care folks and Army folks. But they do offer funding for across different spectrums of healthcare, health innovation. So that is another one. It is a membership organization, and so you can track what's going on and opportunities, but to actually receive the funding, you do have to become a member. AFWorks is yet another innovation within DoD for quick funding for startups and innovative technologies. And it's a matching program. And so you do a pitch. It's supposed to be easier process as opposed to the traditional writing of a long SBIR, and has actually been proven very effective for some of the folks that we've worked with over the years. So I don't want to get too into the weeds. You're welcome to email us if you want more information on any of these programs. Last of the federal departments is the VA, or Veterans Affairs Department. So they do have some research dollars, but they don't do hardly any of the research. It's mostly DoD that does that research, and any research that does happen, it has to have a PI within the VA system. And they do pilot programs, but for pilot programs, they want devices and diagnostics or what have you, different technologies that have been FDA cleared. So it can be very helpful as you're trying to get your product out into the market, because if you can get into a couple of VAs, then you can work on getting across the whole VA system, and then that helps you with sales to other hospitals and health centers. So there are advantages to that. And then there are some key conferences. So today we're really focused on MHSRS, and I'm going to leave those details to Greg. But it's a phenomenal networking conference. It happens every year. Interestingly, last year with COVID, they canceled it completely. They didn't even try to do a webinar. But the Defense Tech Connect sort of stepped in to fill that void in the fall. So they did a webinar-based military conference. So that's another one that may be of interest. And we have to see what happens this year, how they're going to juggle the conference, but we'll be tracking that as well. And then there's other ones that are focused, such as SANSA, which is focused specifically on first responders. And so you have a lot of overlap between the military combat casualty care and then the civilian first responder care professionals at this conference. Another one is the American Cancer Research Conference, which happens every year. And while that is not government run, all the government folks are there. So Ned Sharpless has spoken repeatedly every year at that conference, who heads up NCI. A lot of the different leadership within the institutes are very active in these conferences. BARDA, as I touched on earlier, is a great resource, again, for first response type innovations. They do their own conference every fall, and they did do theirs last fall. It was an all webinar type of conference, but that's also a great one to attend. And then Tech Connect, as I mentioned earlier, they have the Defense Tech Connect, but then they have other areas of Tech Connect conferences, different technologies. The short of it is, at all of these conferences, you have a great opportunity to hear what the priorities are, and then to go target people in a very polite but persistent way, to introduce yourself, to show how your technology, your innovation can help them meet their needs. So we certainly at G2G have gotten so much out of going to these conferences. We've developed great relationships to this day, over a decade later, still working together. And even as a lot of the program managers may move around within DoD, they may move from Fort Detrick to San Antonio. And so you can still work with them. They're just in another office. So really can't emphasize enough how important, especially within DoD, those relationships are. And, you know, another item I'll cover, because we've been really active on this lately, is women's health. There is a growing interest, growing dollars being spent on women's health innovation, women's health care. So if you're in that field in particular, I think that there's a lot more opportunities coming for you in the future. So with that, I will pass it back. Thanks.
Great. Thanks a lot, Liz. Hi, everybody. My name is Greg Kapcar, and we did see one question that popped up. Actually, there were two. Liz answered the one about the VA research and how that works. But Katie, there was a question about the telehealth, and that it keeps, you know, that topic keeps coming up. And kind of in a quick answer, what about remote patient monitoring? Is there any movement for CMS to reimburse remote patient monitoring?
Yeah, so CMS issued a final rule on RPM last year and then gave some clarification early this year about what exactly could count towards time billed for RPM. It does seem like perhaps folks feel that there's not enough flexibility there, and we need to see further strides in that space. So I would not be surprised to see further direction there, and expanded direction. We do have a new director at CMMI who will be starting shortly, Liz Fowler. So I know I'm looking to see what types of kind of patient-centered initiatives in the more innovative space that they might choose to take on in the coming year or so.
Great.
Thanks.
Thanks, Katie. So I'm Greg Kapcar. I am a public affairs director in our Midwest office in the Cleveland area. I've been with G2G for about 4 years now. And my background is in the private sector, started out really in kind of the health and human services world, and got bit by the public policy and really lobbying bug probably about midway through that career. And 20 years ago, I went back and got my MPA, and I've been doing government relations ever since. And so I had done some stuff in-house for a nonprofit here in Cleveland, and had done some earmarks and state budget requests and things like that. And then moved on to the state capitol, where I was the legislative director in-house for a membership association, again, in the health and human services space, much like the membership associations for BioOhio and MD Bio, but not specifically in the bio world at that time. I've managed a couple nonprofits over some time, and then came to G2G, as I mentioned. And I manage our government bioscience grants report, along with a great team of researchers here, and then also work with a number of federal clients. So the last half of this workshop today is going to be on really the military health system and gearing up for the Military Health System Research Symposium, which Liz had mentioned. So on this particular slide, I don't want to spend a lot of time here. It's just really to give you a sense of what the breadth and depth of the military health system is. And think back to that slide that Liz presented earlier with that really big pie chart that showed where all the DoD funding goes. So they've got over 9 million beneficiaries and over hundreds of locations and military hospitals. And then when you look at the VA itself, it's got the Veterans Integrated Services Network by region, and then other medical centers and community-based outpatient clinics that are obviously providing care to military personnel and veterans. So if your tech can meet a military medical gap, some of the key ones that are of top of mind for the military fall into the wound care space. You'll hear a lot about far forward care and point of injury care, and then regenerative medicine, as well as other related topics that we're going to talk about here in just a minute. So we can go to the next slide. As far as DoD opportunities go, legislation shapes a lot of this, and I think you got a really nice primer on that from John and Liz. So I don't want to spend a ton of time there, but I do want to mention about the Army's Future Command. And we have seen the most significant change in reorganization in the military's history in 45 years. And with that came the Army's Future Command, which is really aimed at modernizing the Army. So that's looking at, lethality, long-range precision, next-gen vehicles, things like that. But then there's the Defense Health Agency, which is a joint operation between the Army, Navy, and Air Force. And this is where we see the medical services that are needed to provide a medically ready force and providing health services. So that becomes key. There are also opportunities for companies, small companies and high-tech companies, to do cooperative research and development agreements. this really gets your foot in the door. It doesn't necessarily come with money attached to it right off the bat, but you bring resources to the table. The military brings their labs and their techs and researchers to the table, and together you work on research efforts to solve military medical problems. And that's something that G2G has been really successful at working with our clients on over the years. There's a bullet here about conferences and workshops, and we're going to spend quite a bit of time talking about that here on the conference coming up in August. The listing of funding opportunities are there. I think Liz did a really great job of teeing that up, so I don't think we need to really spend a lot of time here talking about all those different opportunities again. So we can move to the next slide. And just to put on your radar some different events to be thinking about throughout the year. January is typically the Extremity War Injuries Conference out of the Society of Military Orthopedic Surgeons. It usually happens in January. I noticed that I have not been able to find their conference for 2021, but they do have an annual meeting coming up in December in California. Plus, they also have just ongoing meetings throughout the year. So if you're in like musculoskeletal injuries or just that extremity war injury space, this is something for you to check out. March is when MHSRS deadlines are due for the abstract, and we're going to touch on that a little bit more. We've got the SOMSA conference, Special Operations Medical Association, that happens in Florida coming up in April. There's also a conference in June. The Military Health Systems Research Conference that we're going to be talking about happens in August. Typically, they have not set the dates yet, but it's usually around the second or third week in August. And if I said April, I meant August. But so it's August, and it's down in Kissimmee, Florida. And we'll show you how to monitor that on the website. October is a really busy month if you can find connections into the DoD. So the Military Research and Development Command out of Fort Detrick that manages a lot of the combat casualty care and trauma dollars, they have an annual BAA that's open now, and it's actually open all year round. And but in October, we tend to see updates to that call for broad agency announcements. And this is where you can put in for a BAA and get your technology in the queue to be considered for future funding. Liz has mentioned Defense Tech Connect that happens in October. I did see that they're planning to do it live and in person again this year, but again, I guess it remains to be seen as all of that comes to fruition with vaccines and masks and things like that. That conference is usually combined with an SBIR and STTR Innovation Summit. So you really get a good bang for your buck if you're able to go, because it's not only the Defense Tech Connect, but it's also an SBIR conference. And then also in October is a BARDA Industry Day. This is one where they do lightning talks where you can get your technology in front of the medical countermeasures folks and first responders. And this past year, because of COVID, just like with MHSRS, they did not cancel it like MHSRS, but what they did do is they did it virtually, and they pared it down to just one day. So we'll see what happens again this year. There's a Southern Region Burn Conference that happens in December. And then there's just a ton of workshops that are put on by the National Academies of Science, the FDA, Liz mentioned MTech. And then there's BioFab USA, which is the Advanced Regenerative Manufacturing Institute. Sometimes this Army here is Army with an I, which is the Advanced Regenerative Manufacturing Institute. And this is a program that integrates the innovations in cell and tissue cultures with advances in biofabrication, automation, robotics, analytical technologies. So just wanted to mention that. And then vendor days, again, back at Fort Detrick at the Military Medical Research and Development Command, they host typically 8 exhibiting opportunities a year. Again, that kind of got delayed or sidetracked last year with COVID. This year, they're doing some of them virtually. In fact, tomorrow is a vendor day entirely 100% virtual, dedicated to just COVID-19 diagnosis and treatment. So that's going on tomorrow. So that's something to check out. So next slide. So just a quick overview of, again, the Military Health System Research Symposium. This is the largest annual conference that's focused on military medical care and gaps. And it really gives you an opportunity to meet with, there's like 3,000 people that attend every year. It's insane. So we've gone for the last 10, 12, 15 years. As Liz mentioned, it's a really good opportunity to network, to get your ideas and your technology in front of the military. It's usually a 4-day networking conference. And the focus areas there are 5 general focus areas listed here. And we'll go into these a little bit more in depth in a couple slides. And there's just a ton of breakout sessions. If any of you are familiar with the JP Morgan conference that happens, it's similar to that, but not on that big of a scale. But you're doing lunch meetings, you're doing coffee breaks, you just have an opportunity to talk with program managers, leadership is there, and it's just a wonderful opportunity to network. There's a chance to do poster presentations, which we'll talk about, and just again, excellent insights, networking and exposure to the military. Next slide. So if you just Google MHSRS, it's going to take you to their website, and to submit an abstract, they are due next week on March 31st. And you just basically click on these links and you can submit one. And we're going to walk you through what you're going to need to actually make that submission. So before you click on those buttons, you know what you have to have ready and prepared. But something that you probably would want to do, and I highly recommend that you do, is click on the review of the breakout sessions, because in that review of the breakout sessions, it will describe all of those different focus areas that I mentioned, and it will list each of the breakout sessions and what the abstracts need to focus on for that particular topic. So you can really tailor your submission to what they're looking for. Next slide. So when you make your submission, some key things that you want to consider before you actually submit is, one, that you've got to present research data and conclusions, that this is not an opportunity to present product promotion or do sales pitches. They won't even consider you for submission. You can attend the conference, but they're going to reject your abstract if it's not research and data focused. And it must be an original idea and it's unpublished work. And then any abstract that is submitted, if it's not selected for an oral presentation, you'll automatically be considered for doing a poster presentation. So ideally, you know, it's kind of the golden egg that companies are shooting for, is to actually get airtime and a presentation in one of the workshops. But having that opportunity to present a poster is just as valuable, because specific researchers interested in your topic area, they make the point to walk the room and come around and talk to folks that are doing research in gaps that they're concerned about. So here you see there are character limits for each of the sections, and the bulk of the abstract is 8,000 characters, and they don't give you a specific format to follow. So what we recommend that you do is kind of fall back on the basics. Talk about the background, the specific rationale, your technical approach, your methods, the results and the significance that your results have on the military, and in particular, the warfighter, and then conclusions. So it's not a lot of space to put all of that. But if you're wondering, well, how should I format it? That's the basic format that we recommend. There are some learning objectives that those are required. And you have to talk about what will they accomplish, what will they learn, things like that. And then you have to upload a conflict of interest disclosure form, which is on the website, and then you upload CVs. Next slide. Here's a little bit more detail on the specific focus areas and what they cover. The warfighter readiness includes things like infectious disease prevention and treatment, remote monitoring, injury prevention, occupational environmental exposure. The expeditionary medicine category is operational telemedicine, TBI, pain management, in-route care, blast-related injuries, so TBI, burn care, hemorrhage. So I think you're starting to get the idea of what kinds of topics and medical gaps they're interested in. The warfighter performance area is on humans performance and optimization. There's a return to duty category that includes sensory systems as well as TBI post-injury management. And then there's always additional sessions. And this year they've got a special COVID-19 research section, and anything that you submit for the COVID-related section would only be considered for posters. All the presentations this year on COVID are specifically invited. It's invitation only, and it's basically related to military research that's already going on. And then there's also a big military women's health section, which is extremely popular and much needed. So that's another additional session. So let's go to the next slide. I won't spend a lot of time on this. These are just some these are just resources and websites where you can go to find specific grants. And a lot of those grants and opportunities were mentioned earlier in our presentation. And if we haven't said already, these slides will be made available to anybody who's attending the seminar or webinar, and we'll get those out to you by the end of the week. Next slide. Liz mentioned, and I mentioned in my introduction, that we do a monthly government bioscience grants report, and accompanying that each month, we do a monthly highlights call and screen share through Zoom, where we actually walk you through some of the key opportunities, and it's a really informal type of setting. We can take questions and answers and really make it and tailor it to whoever's on the call. So we invite you to attend that, and you can find registration for that on our website. Next slide. So just when it comes to making DoD submissions, it's really important to understand what the program goals are and what the intent of the award is. Make sure that you follow deadlines. We talk to a number of program managers, and they throw out a lot of submissions, one, because they've missed the deadline, and two, they haven't followed instructions. And some of the instructions get so minuscule as far as font size and type of font. And if it's not right, they're going to throw it out. You definitely want to make sure you've got your DUNS numbers and SAM numbers and EBRAP account all set up, ready to go. You keep your pre-applications and quad charts short and simple. Check the reviewers, what the program panel memberships are. That is available on the CDMR website, CDMRP website. So you want to get a sense of who's reviewing the applications. Congress decides what topics are getting funded. So you can see why we've started off this webinar spending so much time on Congress and legislation and authorization bills, because that is another way to influence the process. And then wherever you can, you want to collaborate with the military. So I mentioned those cooperative research agreements before. So you definitely want to consider, how can I build my relationships? Liz mentioned it earlier. It's all about relationships, relationships, relationships. And then how can you leverage those connections into partnering with them and then ultimately getting funding? So we can go to the next slide. And I think at this point, we're going to kick it back to Liz to do some case studies and then close us out for the afternoon.
Thank you so much, Greg. I really appreciate that. We are on the home stretch now. So let's go to our first case study. Here's the thing. If something works for another company, then you should do it too. That's what we're all about at G2G. It's very efficient. So first example of building relationships and long-term support. That was the primary goal for this one. We were able to pursue funding through these relationships, and we're formulated a multi-state strategy. So they had an innovation. This was a cellular therapy innovation that needed to be developed for all kinds of uses within healthcare. And so they had relationships with different institutions, research institutions, universities. And I said, well, great, let's partner up and go after funding opportunities simultaneously from multiple different partners. And so we, in the end, had 3 different state-based initiatives, or in 3 different states, I should say, and we're able to get funding for all of them. It started out with just one, though. So it took time to build relationships, to explain what we do, how we are helping them meet their requirements. It's all about their requirements within Department of Defense. And we delivered on what we promised to do. That was also key. I've heard a lot of input from program managers that they get very frustrated when they work with companies that don't meet deadlines, they don't communicate, they don't provide the reports on status of projects, they don't ask for help when they hit snags, all those types of things. And this client did a really good job of basically not doing any of those problematic behaviors. So they were easy to work with, very reliable, really became a resource. And from that, developed great relationships, got new introductions. We even got a DARPA contract that was pretty exciting based on the relationships and introductions we got from the first program managers. So we did lots of events and engagements with members of Congress to build that support, as well as with the Department of Defense folks. We also attended the military conference every year, and then we started attending the BARDA conference, and that led to even more relationships and more support and more funding. So in the end, you can see under results, we were able to get over $11 million in DoD grants over 4 years. We got $3 million included into the National Defense Authorization Act. And then $25 million contract that technically was for $100 million if certain benchmarks were hit along the way. And so I know that they did the $25 million drawdown, and we're still working through different aspects to accomplish benchmarks, but that's still a ton of money for this small company who I started working with when it was a one-man operation that had spun out of Case Western Reserve and really grew over the years and is now almost 200 employees, multiple states, and a really a great success story. So, but what was key is that long-term investment in building relationships. That's really, really important. So next slide, please. So this slide also is another DoD great example where we were working in regenerative medicine, and we wanted to build relationships and access funding like we're all trying to do. And with this one, we didn't do the multi-stage strategy. What we did is we targeted key leaders within DoD that would be interested in their innovation. And we also targeted the stats on this health problem that was affecting the military. And it's actually a very common health problem for which there's been no innovation in 2 decades. And so we were able to come in and explain our research, what we're doing, how it could help them return to duty faster with shorter recovery times, save money, better well-being, mental health tied to those injuries. So there was a holistic presentation of how we could advance military interests. And so we did a white paper, we found this funding opportunity for them. We then did the submission, and we also then met with the program manager within that was in charge of this funding source at the military conference at MHSRS. And I will tell you that meeting actually was at a critical juncture in our process. We had the client wasn't quite sure if really they should make a submission. And so I asked the program manager, what do you really think? It's just me and you. What do you think about this? And he said, they should make the submission. Absolutely, they should make it. And so I took that back to the client. Sure enough, they made the submission, and sure enough, they got selected. So it was really valuable to have that relationship and to have that program manager really know what it is that we were presenting to them, that what this innovation would do. It was around tendon ligament repair that was a real need for the military. And I also think timing was really important, and having that face-to-face was really important. There's a way people talk to you when they're in front of you that's very different than when they're over email. And so in these days, it has to be over Zoom, but there is a real value to that person-to-person connection. And I think that was really key with this opportunity. Next slide, please. Turning a no into a yes is very, very important. And we were able to do that with this client. And while in the end, it was only $300,000 award, that's still funding that was really critical for an early startup. So with this, this case, we went and met with the program manager who I knew well. I mean, we did like we do for all our clients. We did the strategic roadmap, the white paper, the targeting, really got our ducks in a row before we went and met. And then we met with my contact. And he sort of was like, I mean, it's interesting, but I'm already active in this space. I don't think it's a fit. And so then I followed up with him privately and I said, what's really going on? Right. That was a very lukewarm response. And he said, well, honestly, I'm working with another company. I just don't see the need. I said, all right, tell me more about what you're currently doing. And so I then went back to the client, we went over it, and they said, actually, we can enhance that capability if we team up with that other company. And I said, great, let's reach out. And so we were able to meet up at MHSRS, and that in-person meeting was key. He literally raised an eyebrow and said, wow, come back and see me. I think that maybe we have something here. So after the conference, we went back and met him at Fort Detrick again. And he said, you know what, this really is a fit. So I'm about to come out with my program announcement. I'm going to make sure it really tees up for both of you, and look forward to seeing your submission. So we applied just like the other company. And so I think that's why it's a little bit less, excuse me, funding. But it's an example of how persistence really matters. And there are times when a no is a no because it's just apples and oranges and there's no way you're going to fit in. But there's other times when it's let us really hear what your needs are and let us show you that we can help you meet those needs. So I really want to emphasize again the importance of those relationships and of listening to what they're telling you, because that can really be the key to getting funded and to getting a collaboration through. Next slide, please. We are over time. Sorry about that. So these are final tips for you to take away today, and we will share the slides with you. But accessing funding requires planning. You want to be tracking what's going on. As Greg said, we've got a great tracking system ourselves within G2G. We do the general government bioscience grants report, or GBG report, every month, but then we also do tailored for our individual clients. So if you want a tailored plan, please contact us. We're happy to do that for you. Our plan involves a strategic roadmap, laying out who all the targets are, what we expect to get out of them. Some of them are connections, some are actual funding. We then write white papers tailored to each of those. That's really important. And if you do your own writing, problem, solution, results, you got to make sure you're hitting each of those, and that it's super clear. Someone who's busy, who's a gatekeeper, can quickly understand what it is you do and why they should care, how it can help them. Then we set up meetings only after we've done those initial first steps. And in those meetings, you do a deeper dive with a PowerPoint presentation, any kind of demonstration of your technology or your innovation. And they ask questions, they interrupt. That's actually a good thing. You want to hear what they're most interested in and things that you can do. You can tweak your language, certain opportunities. Maybe it hasn't been announced yet, but it's coming down the pike. They can give you that intel. They can also give you introductions to other program managers in other offices. Also, attending conferences obviously is very clearly important from those case studies that I shared. Building relationships, think about long-term, not just short-term. You want to pursue both that agency side and the congressional side. As John and Katie talked about, there's so much going on right now. We've got a new administration that's all about putting patients first. There'll be lots of big, bold efforts coming out of his first budget, I expect. And the same in Congress. We've got 2 women chairing chairing and ranking the Appropriations Committee that determines all the dollars where they go. And so I think that there's just some very distinctive opportunities now. And during COVID, we're in sort of a spending spree. So that's an opportunity as well. So anyway, for a lot of reasons, I think it's important to make sure you're tapping the congressional side, not just the agency side. Also, listen to what they're telling you. They're telling you opportunities, or telling you priorities, or telling you where there's funding, where there isn't funding. That's really key in order to maximize your effectiveness in engaging with government. You want to respect timing and matchmaking. You really want to make sure that you're 70–80% there. It's just not worth your time. And it's also better to find that out early, right? It's way better to be dumped on that first date than at the altar. So that's what we want to do, is make sure we're getting the information and really narrowing down on those opportunities where we have the best chance for success. When you do make those submissions, make sure you're reading the directions and following the intel that you've gained from your relationship development. And finally, follow up, stay engaged. You can send them updates. Do not put them on your email list for regular emails. Just stay in touch every couple months or so. I think that's really important to long-term engagement and success. And that's our final tips. We'll quickly wrap up with any final questions.
So Liz, there is one question about the Rapid Innovation Fund, that it was defunded last year. Hearing any encouragement that it will return in 2022?
I am not very optimistic about that. I saw that as well. That was very frustrating because that was a good opportunity. We actually secured some funds through that program. But I don't see it, especially because they brought earmarks back. I think that there will be other funding sources to make up for that. And then the other one is the Joint Warfighter Medical Research Program, which we did not touch on, but that's another new program that was created that I do think will continue to be funded. So there are some other sources, but unfortunately I don't expect that program to happen again. I would love to be wrong though.
Well, there are no other questions, so I think it's a wrap.
Awesome. Thank you so much for dialing in. Like I said, we will be sending out those slides, and please stay in touch. You can follow us on Twitter, check our LinkedIn account and our website for updates. We are constantly giving updates on funding opportunities. Thanks so much.